exercise. Hand hygiene. Hi, my name is Caitlin. I'm a student nurse at Gilbert College, and I'll be doing your musculoskeletal assessment. Is that all right with you?
Yes.
All right, so before we get started, I need to verify your name and your date of birth.
Miss Edna Ramirez, 07/19/07.
All right, Mr. Ramirez, do you have any allergies?
No.
Okay, and do you know where you're at today?
I'm at the hospital.
All right, and what day of the week is it?
Thursday.
Okay, and do you use any assistive devices?
No.
All right, and 0 being none, 10 being the highest, what would you rank your pain today?
0.
All right, and what is your height and your weight?
5'1", 140.
Okay, and what have you had to eat today?
Sausage, bacon, eggs.
All right, and so before we get to your assessment, I just need to grab some quick vital signs. I'm gonna start with your blood pressure. Do you have a preferred arm?
No.
Alright, and so before getting your blood pressure, I'm gonna do your initial systolic first, okay?
Okay.
And feel some slight pressure. Alright, and we're gonna wait 1 minute and then I'm gonna get your blood pressure reading, okay?
Okay.
Alright, it's been 1 minute and I'm gonna do your blood pressure, okay? You're gonna feel some pressure again. Alright, your blood pressure was 116/74. Alright, so we're going to move on and I'm going to palpate for your radial pulse. So what I'm going to have you do is bring your arm across your chest. Thank you. Okay, alright, so your heart rate was 72 beats per minute and your respirations were 16 breaths per minute, which is perfect. Right where we want you to be. Alright, and so next I'm going to do your temperature, okay? I'm going to place this under your tongue. Alright, so your temperature was 98.6 degrees Fahrenheit, and now I'm going to take your oxygen saturation and place this on your finger. Alright, and your O2 saturation was 94%. Alright, so now we're going to move on to your assessment. So what I'm going to have you do is sit straight up. Alright, and I'm going to put my finger here. What I need you to do is set your finger to your nose and then to my finger, okay? Again. And again. Okay? Alright, so now place your hands out like this. Alright, so I'm going to check your capillary refill. So I'm going to squeeze each finger. Okay. Now squeeze my fingers. Okay. Alright, and put your arms out like this. Alright, and do like this. I'm going to do your temperature, or your radial pulses. And your skin temperature. Alright. Alright, so now I have to do the same thing, but I have to do it on your lower extremities, okay? So I'm going to do your capillary refill for your toes and look in between each one, okay? Okay. Okay, and I'm going to look in between each one. Okay, alright, and so now I'm going to do your strength, and I'm going to put my hands here, and I'm going to have you try and push up. Right, and now at the bottom, I'll push down. Okay? All right, and so before I palpate for your pulses, what I'm gonna have you do is bring your heel to shin and go down. And now the other side. All right, and so now I'm gonna check your pulses, okay? So I'm gonna do your pulses. And your posterior. And your dorsal brevis. Okay, and I'm gonna palpate for edema and temperature. Okay. All right, so now I'm gonna have you stand up. All right, and if you could walk that way. And walk back. Okay. All right, so now you're gonna follow me. Well, no, I'm gonna have you bend over and touch your toes, and I'm gonna assess your spine, okay? Okay. Now you're gonna follow me. So you can go like this, here, here, here. All the way around. Okay, and then here, here. All right, so now to the lower extremities. Bring it out, all the way around. Other side, perfect. Now here, here. All right, and now we're gonna squat. Okay, all right, you can have a seat. All right, are you comfortable?
Yes.
All right, I'm gonna hand you this call light. I'm gonna do my hand hygiene. Do you need anything else from me today?
No.
All right, so if you don't need anything else, I'm gonna go document, all right?
Okay.
Thank you. Okay. Client is alert and oriented. Times 4. Client's facial expressions and body position are relaxed. Client's nutrition is appropriate for height and weight. Client's pulses are equal bilaterally with an amplitude of +2 in upper and lower extremities. Client's skin is appropriate for ethnicity. Client's skin, hair, and nails are evenly distributed. Client's skin is warm and dry to palpation and has no edema noted in upper and lower extremities. Client capillary refill is less than 3 seconds in upper and lower extremities. Client's grip strength is equal bilaterally in upper and lower extremities as well. Client's gait is equal. Client's coordination is equal bilaterally in both upper and lower extremities. And client has full range of motion. Client reported no pain. Client's nutrition status is appropriate for height and weight. And client's facial expressions and body position are relaxed. And I believe that completes my assessment. Thank you.